Hindsight. It makes difficult things seem so easy to have predicted. The stock market, for instance. It's very easy to look at today's most successful companies and to say, with hindsight, that it was obvious that those were going to do well. Obviously, you do this forgetting about all the other equally successful looking companies that either didn't grow or that disappeared over the same course of time. COVID is survivorship bias. It's the one that got away, the disease that we failed to contain or to respond to until it was too late. But of course, now it's happened, we look back at its story and at all the mistakes that were made along the way and are all like, yeah, we should have expected this. We were warned. Bill Gates, among others, was warning us for years that mankind was due a pandemic like this. Personally, I don't buy much into the blame game. China's terrible animal welfare standards certainly need improving. Maybe it did leak out of the nearby lab that was researching the coronavirus at the time. Frankly, I don't think it matters much where it came from. We can worry about that later. What does matter at the moment is where it is right now and how we deal with it. One area where I am guilty of hindsight is when I look back at the COVID cases since the start of this pandemic and how I feel kind of stupid for not having predicted this particular timeline. Of course it was going to go up then or down there or to hover at 40,000 cases and 150 deaths a day for several months after reopening, as is the case right now. It's sort of growing a bit, but not by an alarming rate or anything like that. So right now we are in unexplored territory, both in terms of cases and how it feels to be living through it. We've gone through peaks and troughs before, but not through such a prolonged plateau and at such a high level. Every day, for months on end, we've had roughly the same number of cases as we did at the highest peak prior. More people in this country have been diagnosed with COVID since this July than they were in the year and a half leading up to that point. But we've got the vaccines and we've done our time in lockdown. And there feels like nothing else to do other than to try and return to normal, even though we're in a country with one of the highest infection rates in the world right now. I feel guilty for not feeling more about it, but I just can't at this point. I'm just getting on with my daily life. I'm wearing masks in shops, washing my hands after opening gates on walks, and occasionally turning down events because they don't seem quite worth it. And I still feel more disgusted than normal when an old lady without a mask on openly coughs as she walks past me. Bet that's how she gets her kicks. But I'd say we're about as close to normal as we've been since the start of this pandemic. Mask usage has plummeted since the reopening in July. I'd say that in shops it's about 50-50 now. And I'm attending social events again. Of course, the moment I get COVID from one of these, hindsight will rear its ugly head and I'll feel stupid for having been so careless. But that's hindsight for you. The Southwest region where I live was hit with a bit of a scandal. 43,000 PCR tests came back from a laboratory as false negatives, meaning that potentially 43,000 people with COVID had followed the rules, had taken tests, and were told that they didn't have COVID when maybe they did. Isn't that terrible? That surely must have helped spread the disease in this part of the country. Two of the biggest victims of the pandemic are hairdressers and gyms. So many of us now cut our own hair. The secret is out. It isn't hard to do, provided you don't mind shaving it all down to the same length. And I've not really attended a gym since the start of the pandemic. It was hard enough to find the willpower to get there already, but the idea of being in an enclosed area when you're puffing and panting amidst a pandemic was enough to make me find alternatives even when I did have the motivation. I do a lot more running now and just the other day discovered that my gym has gone out of business. I guess other people were more proactive at cancelling their membership than I was. It dumped all its stuff outside the front doors and is yet to notify me personally. Vaccines. When this whole thing started, I thought being vaccinated would have been enough. Then we were told that we need a second jab for maximum protection because it isn't enough just to have immunity. Apparently you also need active antibodies in your blood to begin combating the disease straight away because the Delta strain's super evil and all that. But apparently even this second dose's defences dies down after about half a year. So now a third booster vaccine is being rolled out and hundreds of thousands of people in England are receiving them daily. It's definitely a lot quieter this time around though. I'm aware that it's being rolled out, but I'm not waiting for it with such trepidation because I have already had 2 doses, and the second one was quite an unpleasant couple of days for me. So yeah, this third booster jab hasn't reached down to my age group just yet, but it should apparently greatly boost immunity for another 6 months, which should see the most vulnerable people through the winter at least. Will that be it? Or will this booster jab cycle continue until COVID burns itself out or mutates into a less dangerous variant? The future of COVID right now seems very uncertain, though I'm sure it'll be obvious what happens next, with hindsight. But the vaccination effort so far can be seen and felt right now. We currently get about 150 deaths daily, which is horrible, but in the last wave it was closer to 1,000 a day with current case rates. So that's a substantial drop. And I trust the case and death rates in this country. England is one of the best countries in the world at testing and tracking this disease. So deaths are a good 6 or 7 times lower than they were in previous waves. And I thank vaccines for that. That's a major win right there. Those are real, literal lives that have been saved, and which continue to be saved every day. That extended, painful lockdown we endured for the first half of the year is now paying off, and will continue to do so for the foreseeable future. That makes me proud. We haven't stopped the disease, we haven't prevented all deaths, but we have struck a very logical middle ground, thanks to our efforts so far this year. And other European countries are seeing the same thing. That is, a much lower death rate than was seen in earlier waves. Compare that to places where the vaccination rate is lower, like in Russia where it's still less than 40%, and the difference is staggering, with the current death rate just as high as it was in previous waves. Unfortunately, it's the same thing in Israel as well, which was the poster child for the vaccination rollout at the start of this year. It's sad and confusing to see their death rate as high as it is. And while you could say it's because their immunity has worn off, or because of Delta, I just feel the need to point out Israel, because it seems dishonest of me to not mention a highly vaccinated country that's still struggling with its death rates. COVID has been this massive fog of war, and some people prey on this to push misinformation. It's just unfortunate that it takes much longer to explain why the misinformation is misleading than it is to spread that misinformation in the first place. I'm talking about statements like, "I refuse to take the vaccine because we don't know its long-term side effects." Or how about the good old, "more vaccinated people die than unvaccinated people"? Because both of these statements rely on half-truths to make it long, boring and difficult to explain why it's wrong. Yes, more vaccinated people do die from COVID than unvaccinated people, but only because the overwhelming majority of vulnerable people have been vaccinated. If you took a moment to look at the data, then you'd see it as a shining testament to how good the vaccines actually are. I get particularly angry with this first statement. It's clearly a statement borrowed from anti-vaxxers in general, because if you use it, then you can dismiss anything new for this same reason without needing any evidence to back it up. But it cuts both ways. We don't know the long-term side effects of COVID either. Though this is sort of a lie. We do know that COVID can cause many serious short-term health risks, some of which will become crippling in the long term as well. So really, although disguised to sow doubt, both of these statements ultimately support the vaccine effort more than they detract from it. Fortunately, enough time has now passed, and enough data collected, for large-scale studies to start being published. This one concludes that you are 32 times less likely to die from COVID if you're fully vaccinated, based on all the information collected this year leading up to September the 24th. I appreciate this data, but err on the side of caution with regards to how much we can conclude from it, because this is not the end of the story. This is just one of hopefully many studies done on this topic, and over time we will build a better, more accurate picture of the situation than what's seen here. I know this study won't be enough to convince some people. Even I'm a bit doubtful about its accuracy, given the immense number of variables it's had to account for in this year leading up to this point. It spanned the time starting when everybody was unvaccinated and in lockdown, to the point when most of us are vaccinated and free to do whatever we like again, and with many abrupt changes in the circumstances in between these 2 points. And what about people who got COVID more than 6 months after being vaccinated? Does it account for all that stuff as well? What I'm getting at is, it's great that it's concluded that vaccinated people are less likely to die of COVID, but it's also important to be critical of and aware of a study's limitations. This isn't the same as dismissing it, but I know from my own experience of doing research that if I don't cover something in enough depth for some people, especially those who want to disagree with my findings, then they're happy just to dismiss the whole thing as not being good enough. So let's see this study for what it is. It's a good starting point that future studies can use to build upon or to investigate subsections of. For us in England, if COVID is going to burn through the population, then it makes sense to get it over now, before winter starts, rather than to have COVID compound the usual winter flu that puts strain on our hospitals. So with that in mind, I think we've done about as well as we could have hoped to this year, and I think it puts us in good stead for the months to come. My one criticism with England's strategy this year is how we opened schools and then started vaccinating children. I believe this is the major reason that the case numbers and deaths are as high as they are right now. You can see it in these published charts. It's absolutely booming across secondary schools, while the only growth I can see in adult populations is for 35 to 49-year-olds, who would be the parents of those children in the schools. 12 to 15-year-olds are now getting 1 dose of the vaccine, and there's still no plan for under 12s. I know that children aren't badly affected by COVID, but they are in close contact with family members, many of whom will be more vulnerable. So it just feels like reopening the schools has undermined the social distancing and precautions that the rest of us have taken this year, and it will lead to deaths that could easily have been avoided. There have been talks of a Plan B in England, which would involve locking down again if cases begin to rise. I think that would be catastrophic. We have had a plan up till now. We slowed the disease's spread until the vaccines could be rolled out, and now we're trying to carry on with our lives. If we were to lock down again tomorrow, then what would that say? What would it achieve? that would be us admitting that we have no plan other than to shut everything down every time the cases rise. And I don't think that most people would honour it. I don't even know how seriously I'd take it. I feel like it's getting to the point now where we have done everything we can to minimise the risk that COVID poses to us. I understand locking down briefly if the NHS is on the brink of collapse, but not if it's just because we think the case rates look a bit scary right now. Deaths remain stable. It's not like the case rates are exponentially increasing like they were in previous waves. They're just very high and might be getting a bit higher still. In which case we should adapt accordingly, but not to slam on the brakes in a knee-jerk reaction to the situation. Like I said, I really hope we don't do that. A public health campaign has been launched, advising people to open windows over the winter months to minimise the risk of spreading COVID onto friends and family. I can only assume whoever recommended this doesn't live in England, or they'll have known that the temperature in this country drops pretty low in the winter, and that with gas prices the way they are right now, nobody in their right mind is going to open a window on Christmas Day, not even during a pandemic. Let me end this video by taking you on a journey with me to one of my social occasions this month. We hosted a Halloween party for friends and family, made it into a bit of a LAN as well, because why not? Unfortunately, one of my friends couldn't make it because he went down with COVID the week before, and I'm proud of him for abiding by quarantine rules, even though it is sad because it means I might not see him again, since he's moving to America in a few weeks' time. Almost a week has passed since our Halloween party, and nobody's fallen ill from COVID, so I think we got away with it. But I thought I'd share with you the experience and the small ways in which COVID made an impact. For science. Before the party started, I went into town with my friend to look for outfits to wear. Did you know that very few charity shops sell glasses? We were lucky to run into a guy who just happened to have been given a full bag of them, so that was one of our outfits sorted. I had my eye on a Goblin King costume, and went about buying women's clothing and jewellery. An old lady in a charity shop picked a fight with me over the pronunciation of buoy. Then we encountered the first protest that I've seen in my city, which of course I filmed to show you all here.
Stand up! Stand up! Stand up! Stand up! Stand up! Stand up!
Back at my place, the party started and we had a good time. We adopted our LAN names, which have admittedly got a bit tamer over the years. We played Insta-Jib on Unreal Tournament, had a game of AoE, brutalised people in SWAT 4, then ended with some Rising Storm as we readied ourselves for a night out. I got dressed and we headed out to the gay bar, because of course we did. I lubed the pool sticks up with my hand sanitizer before we used them. At one point an old man came up and touched one of my friends on the arm, and so I dramatically and rather drunkenly lathered his arm in alcohol hand wash and rubbed it up and down until it was sufficiently sticky and disgusting. We moved on to the next place, by which point our snookering abilities had diminished. We spent the rest of the night here, but on the way out, I was stopped by a guy who explained to me in great detail what the word placebo meant. Of course, he got close enough to me to spray me with spittle. I wasn't sure where he was going with all of this, but just before he headed off, he suddenly got right up close to my ear and whispered, "COVID is placebo."